Well, a brain concussion is when we get hit on the head and the neck has to be moved because it wiggles the midbrain when you hit the back of the head, or when you fall in injury, or you get hit on the side of the head if you're boxing. It temporarily loses consciousness. Now, usually the consciousness that we lose is 5 or 10 seconds. It can be 10 minutes. And when the person wakes up, they usually have had retrograde amnesia. That means they can't remember for 2 or 3 hours before the head trauma. That's normal. That usually comes back. The question is, do we need to see the doctor, and do we need to get a CAT scan? Now, when you have a brain concussion, there's 2 things to really worry about. Was there an active blood vessel that broke during that time? Very common if you get hit on the side of the head, and that the patient loses consciousness, wake up, and immediately go back into a deep coma. Very, very dangerous. 911, have to go to the emergency room. Usually when people are knocked out, it's better to go to the emergency room. The other one is if you get hit today, there may be a little blood leak. It's walled off. It brings fluid into the area. It's called a subdural hematoma. And slowly over a period of 6 months, you start getting headache, blurred vision, maybe some numbness in extremities. Very, very dangerous, and you need to think about that. Brain concussion, work that out with your doctor. Probably best to go ahead and get a CT scan and let him follow you greatly.